Assalamu alaikum. Congratulations on getting into med school. Today we are starting our chapter introduction, which is the very basic and first chapter of anatomy, and it is important for the understanding of our anatomy as a very important subject of our medical knowledge. The term anatomy is derived from Greek word anatom, which means cutting up. There are subdivisions of anatomy, and we will study it one by one. Cadaveric anatomy is study on dead bodies with the help of naked eye. Regional anatomy is studied in which the body is studied in parts upper limb, lower limb, thorax, abdomen, head and neck, and brain. Systemic anatomy in which the body is studied in systems like osteology, muscular system, articulatory system, vascular system, nervous, respiratory, digestive, urogenital, and endocrine system. Living anatomy, in which the body patient is studied through inspection, palpation, percussion, auscultation, endoscopy, radiography, and electromyography. Inspection is done with the help of naked eyes when the patient enters and doctor examine his gait, his physique, his weight, his color, his complexion. Palpation is and percussion is done with the help of the hands. Auscultation is examination through stethoscope, and endoscopy is examination with help of a camera. Bronchoscopy to examine the respiratory system, and gastroscopy to examine the GIT. Embryology is study of prenatal developmental changes. Prenatal means before birth. Histology, surface anatomy, which is study of deeper parts in relationship to the skin surface. Radiography, which is study of bones and organs with the help of ultrasound and CT scans. Comparative anatomy, in which we compare the structure and functions of other animals and their different body parts with the human body. Physical anthropology, it deals with the external features of different people, different races, and the prehistoric remains. For example, we study and compare the physical appearance of Asians with that of Africans and with the people who lived 1,000 years ago. If we have some prehistoric remains or bones, then applied anatomy is the medical knowledge which is used in medical and surgical practice. Like when a patient with pancreatitis comes, you palpate the pancreas on the left side. There is in the second quadrant. Then experimental anatomy. It is study with which determine the form, structure, and function of different parts of the body. For example, when a person is lying all the day and is not doing any work, he is living a sedentary lifestyle. His muscle atrophy starts. When a person is doing exercise regularly, he develops well and good muscles. Then we have language of anatomy. First important thing is positions. We have the anatomical position in which a person is standing straight with hands by side, palm facing forward, both feet together. Then we have supine position in which a person is lying on his back with hands by side and the palms are facing upward. Then prone position and a person is lying on his face, chest and abdomen. Then lithotomy position in which the person legs are supported in straps and this is mostly used in delivery. Then we have planes which divide the body and that is important for anatomical knowledge. The first one is median or mid-sagittal plane which passes through the center of the body and divide the body into right and left equal halves. Then a plane which divide the body into two parts but they are not equal is known as sagittal plane. Then coronal plane which divide the body into anterior and posterior. Transverse plane which divide the body into upper and lower halves. The first one is median or mid-sagittal plane, the one in pink color. Then the transverse plane which divide the body into upper and lower half in the coronal plane which divide the body into anterior and posterior. Then we have some terms used to define the states of different parts of, for example, the trunk, the head, the upper and the lower limb. We will study them one by one. You don't need to cram it. At the end of the year, you will know what the movement means. But this is just for understanding. Ventral or anterior is in front of the trunk. Dorsal or posterior is back of the trunk. Median is close to the midplane. Lateral is away from the midplane. Proximal, cranial or superior is close to the head. Distal, caudal, or inferior is close to the lower limb. Superficial is towards the surface of body and deep is away from surface or skin. Ipsilateral is on same side and contralateral is on opposite side from another structure. Invagination is projection inside and evagination is projection outside. This is ventral or anterior aspect. The back side is dorsal or posterior aspect. This is medial. This is lateral in comparison to the medial. This is proximal cranial or superior. This is distal caudal or inferior. Superficial is close to the skin and deep is away from the skin. This is superficial and this is deep. This is ipsilateral, which is on the same side, right foot with right leg. And contralateral, left foot and right hand. Then we have invagination and evagination. You can take a picture and learn it later. The term used in relationship to the lower limb. We have posterior aspect, which is back of lower limb, anterior aspect, which is front of lower limb, medial border, which lies along the big toe. Big toe is also known as helix. Lateral border, which lies along the lateral toe, lateral border of leg, and lateral border of thigh. Leg is the area of a body between the foot and the knee, while thigh is between the knee and the hip joint. Flexor aspect is the back of the lower limb, and extensor aspect is the front of the lower limb. Remember, in flexion, the angle is decreased, and you can just know it by your knowledge or using your brain. It knee flexes in the backward direction. Then proximal is close to the root of the limb, while distal is away from it. We have some terms used in embryology. Ventral is towards the belly, dorsal is towards the back, cranial or rostral is towards the head, and caudal is towards the tail. This is anterior surface and this is dorsum of foot, while the lower surface of foot is known as the plantar side. Then we have some terms used in relationship to the upper limb. Ventral or anterior is the front aspect of foot, dorsal or posterior is the back aspect of the foot. Medial border lies along the little finger and medial border of forearm in arm. Lateral borders follows the thumb, lateral border of forearm in arm. Proximal is close to the root of limb, while distal is away from it. Palmar aspect is front of the palm. Dorsal aspect is back of the palm. Flexor aspect is front of the upper limb. Dorsal aspect, extensor aspect is back of the upper limb. This is a picture. You can see ventral or dorsal. This is ventral or anterior aspect. The back is dorsal or posterior aspect. This is the medial border towards the little toe. This is the lateral border towards the thumb. This is proximal side and this is distal side. This is the palmar side of hand in which the creases and lines are present. In the dorsal side is the back side. Flexor aspect is the front. This is flexor side and that is the extensor side. Because decrease in angle occur when these two surfaces are brought close. Then we have some movements in the body. There is gliding movement, angular movement, rotation, and spatial movement. Gliding movement. The bone moves back and forth from side to side with respect to another, but the angle does not change significantly. In angular movements, the angle increase or decrease. We have four types basically: flexion, extension, adduction, and abduction. Then lateral flexion is a spatial movement that occurs in the trunk that is tilting toward the right or left side of our waist. Rotation is a bone revolves its own longitudinal axis. This is medial rotation in which the anterior surface is turned towards the midline, and lateral rotation in which the anterior surface of a bone is turned away from the midline. Then spatial movements occur at some particular joints. For example, pronation and supination at radioulnar joint and protraction and retraction at temporomandibular joint. This is a picture of gliding movement. This is a picture of lateral flexion. This is a picture of medial rotation and this is a picture of lateral rotation. This is supination and this is pronation. This is protraction and this is retraction. Then we have some movements in the upper limb. There is flexion, extension, abduction, adduction, circumduction, medial rotation, lateral rotation, supination, pronation, adduction, abduction, opposition, and circumduction. Flexion. When two surfaces are brought close to each other. This is flexion Extension. When the surfaces are in which approximation is possible, this is extension. This is abduction. When limb is taken away from the body, and adduction when limb is brought close to the body. This is abduction, and this is adduction. You can remember it by ad. Then circumduction. When the movement is in circular motion. Then medial rotation. Circumduction is combination of flexion, extension, abduction and adduction. Medial rotation, when the arm rotates medially, bringing the flexed forearm across the chest. Then lateral rotation, when the flexed forearm is taken away from the body. Then supination, when the palm is facing towards face or upward. This is supination. In pronation, when the palm is facing downward. We can give its example by supination when we are bringing the food to our mouth, and pronation when we are picking the food from a plate. Adduction is when all fingers are brought closer to each other, and abduction when fingers are separate. This is abduction. Center is the center is line is passing through the middle of the middle finger. Opposition of thumb, when the thumb touches each finger. This is opposition of thumb. In circumduction, in extension, flexion, abduction, and adduction occur. This is circumduction of thumb.